People were asked to remove their masks, according to the mainstream media. Now, these CEOs were asked to remove their masks just before meeting with Mike Pence in Iowa. These are some of the big meat people. And, of course, the left wing is going to swing it in their direction and be like, oh, my God, Mike Pence is not following CDC guidelines. Pence will not self-quarantine and plans to be at the White House on Monday, as he should be, because he has a job there. But the U.S. is risking a second coronavirus wave and a depression, economist Mark Zandi warns. The second wave is not the problem. The depression is. The depression is caused by shutting down economies, not by the coronavirus. The coronavirus response, the response to the coronavirus causes the depression, not the virus. The virus is barely causing anything. Now, scientists are concerned that the coronavirus is adapting to humans, and it is. It's mutating. Up to 45 strains have been found since the beginning of the outbreak, and many of them are not going to be, well, very receptive to any vaccine that's being developed currently because the virus is mutating, and the vaccine they're developing is for earlier strains. And that's what we're getting to here, vaccines and the fraud involved in vaccination. Let's talk about some facts. Now, you're looking at a document at the U.S. Department of Health and Human Services, the Office of the Assistant Secretary for Planning and Evaluation, CDC, influenza deaths, request for correction, which, by the way, has never been corrected. Now, the U.S. data on influenza deaths are false and misleading. The Centers for Disease Control and Prevention acknowledges a difference between flu death and flu-associated death. Now, before I continue, let's put in place COVID death and COVID-associated death, just in the back of your mind, okay? Yet, uses the terms interchangeably. Additionally, there are significant statistical incompatibilities between the official estimates and the national vital statistic data. Compounding these problems is a marketing of fear, a CDC communication strategy which media experts predict dire outcomes during flu seasons, and hundreds of millions of people get vaccinated. That's a lot of money. Now, the CDC website states that what has become commonly accepted and widely reported in the lay and scientific press annually is 36,000 Americans die from flu. And there are links preceding this. But why are flu and pneumonia bundled together? That's the big question. Is the relationship so strong or unique to warrant characterizing them as a single cause of death? Well, David Rosenthal, director at Harvard University Health Services, said people don't necessarily die per se of the flu, the viremia. What they die of is a secondary pneumonia. So many of the pneumonias are not viral pneumonias, but secondary pneumonias. Dr. Rosenthal agreed that the flu-pneumonia relationship was not unique. For instance, a recent study, quoted, found that stomach acid suppressing drugs are associated with a higher risk of community-acquired pneumonia, but such drugs and pneumonia are not compiled as a single statistic. CDC states that the historic 1968-69 Hong Kong flu pandemic killed 34,000 Americans. At the same time, the CDC claims that 36,000 die every year from the flu. So what's going on? Clearly, if the 1968-69 Hong Kong flu was actually a pandemic and only killed 34,000, and every year 36,000 Americans die from the flu, then someone is lying. That would be the CDC. According to the CDC's National Center for Health Statistics, NCHS, influenza and pneumonia took 62,034 lives in 2001, 61,077 of which were attributed to pneumonia. Are you picking it up? 257 to flu. And in only 18 cases, let me repeat that. In only 18 cases was the flu virus positively identified. Okay? So let's break that down for the layman. And I'm just going to pop my video up here because this is crazy. I had to share this. Out of the 62,034 lives in 2001 claimed by the flu, 61,777 were attributed to pneumonia. Only 257 were contributed to the flu. And out of those 257, only 18 cases was the flu virus positively identified. This is the 2000. What's the data? This is the 2002 data. Okay? That's crazy. Only 18 confirmed out of the 62,000 claimed. The NCHS data would be compatible with CDC mortality estimates if about half the deaths classed by the NCHS as pneumonia were actually flu-initiated secondary pneumonias. Do you see what's going on here? They're padding the numbers so that you go and get the free vaccine that's paid for by the government. This is so that multi-billionaires become trillionaires, if that's such a thing. It will be. And the likes of Bill Gates and other huge players in the big game control the narrative of the world. They don't care about what they inject into your arm. The fact is that these vaccines cause more harm than help in many cases. Some cases they cause some help because I am a big advocate for certain protocols that help save lives. In the majority of cases, what we're revealing here is that it's not to save lives. So please read this publication. And let me get down here to the bottom. At the 2004 National Influenza Vaccine Summit, can you even believe people that are there at a vaccine summit? Co-sponsored by the CDC and the American Medical Association, by the way, Glenn Nowak, Associate Director from the Communications at the NIP, spoke on using the media to boost demand for vaccines. Now, I just showed you that only 18 of the 62,000 purported CDC flu deaths were actually due to the flu. 18 out of 64,000. And only 257 period confirmed as flu. 257 out of 65,000 cases confirmed as flu. Only 18 were tested as positive. So there's only 18 confirmed cases for that data set, by the way, of flu deaths from 65,000 or so. So let me get back where we were. In 2004, the National Influenza Vaccine Summit, co-sponsored by the CDC and the American Medical Association, Glenn Nowak, Associate Director for the NIP, spoke on using the media to boost demand for vaccines. One step of a 7-step recipe for generating interest in and demand for flu or any other vaccination occurs when medical experts and public health authorities publicly state concern and alarm and predict dire outcomes. Now, months ago, these experts, the ones that banged married people and other stuff that have been fired or left their job or whatever, they claim dire outcomes. 2 million deaths in the U.S. by now. Crickets. 500 deaths in the U.K. by now. Crickets. And urge influenza vaccination. So the CDC, the AMA, and the National Influenza Vaccine Summit of 2004 were not meeting to save lives, to keep people well, to protect the population. They were meeting to state concern and alarm and predict dire outcomes to to urge vaccination. That's disgusting. This is like big tobacco to, to make our kids autistic and to make you get sick because you injected a disease that you didn't have and now you have it. And there's the proof. It's in the documents. I'm going to share you this document. Another step entails continued reports that influenza or COVID-19 is causing severe illness and affecting lots of people, including children, with some weird stuff up in New York right now, helping foster the perception that many people are susceptible to the bad case of COVID-19, which they're not. 99% of you are not susceptible to this. 80% that get it will have no symptoms. Do you see what's going on here? Preceding the summit, demand had been low in the early 2003 flu season, so they needed to get their numbers up because these companies need to make money. At that point, the manufacturers were telling us that they weren't receiving a lot of orders for vaccines in November and December, and they were worried. Dr. Novak on National Public Radio recalled, it really didn't look like we needed to do something to encourage people to get that flu shot. If flu is in fact not a major cause of death, this public relations approach is surely exaggerated. Moreover, by arbitrarily linking flu with pneumonia and other stuff, like COVID-19 is currently, current data are statistically biased, period. And until corrected, and until unbiased statistics are developed, the chances for sound discussions and public health policy are limited to zero. So, this is just a replay of a replay of a replay. And I just replayed it for you. I'm going to leave you links to this document, and the facts are in. And the facts are right in your face. The new killer is the cure and your stupidity. Measles vaccines kill more children than measles, and it's not even close. Death due to measles from 2004 to 2015, 0. Death due to measles vaccines, 2004 to 2015, 108. And I rest my case. Proper prior planning prevents piss poor performance when you've been gobbling up the gobbledygook from the 6 multinational corporations that made your child autistic. It's sadistic. And they've padded the flu numbers for decades, and the population just goes along with it. They do not question the narrative. Now, thankfully, we do not live in a communist country, so they can't shoot us all and shove us in a hole like they do in China. So more of you need to speak up about these facts quickly. The sooner, the better. If we can reach a tipping point, if 5 to 10% of the population has been fed the actual information and they've digested it correctly, well, there will not be flatulence. There will be action. And that action will be in the form of, well, unjust rules were meant to be broken. And many of the rules in place in states and cities around the country are unconstitutional. Beyond that, I have nothing else to say. If you think I'm a bad person because I have never put a fucking mask on in a public place, well, I can assure you I haven't killed grandma because there's only one death in my county. I don't know that person. They've never been in contact with me, and they were probably came from Italy. That's all I have to say. Share this with like-minded people. Don't believe the hype. It's a sequel. If you wear a mask when you're driving in a car, you're a COVIDiot. If you think that preventing other people from getting this virus is helpful, you're also an idiot. This just prolongs the unemployment, the lockdowns, the shutdowns that will be in perpetuity so the globalists get what they want. Is that what you want? I didn't think so. At 8 p.m. every night, we should all cough into the air so that everyone gets herd immunity. Will we get herd immunity from stupidity? I doubt it. But the more you delve into the facts, the more they kick you in the ass. Share this with like-minded people. Don't take the pill. Don't take the stick in your arm. Don't take the prick. Bill Gates is the most disgusting oligarch in the world. There are a few others similar to him. He gave us Windows, which is ridden with viruses, and now he wants to eliminate viruses from your world. What a joke. Period.